Okay, so what I want to do is show you some of the acupressure points and stroke trigger points as well. We're going to look at both of these at the moment. So, let's say maybe you've gua sha or whatever you've done your massage. When you're doing your massage, you can also do specific work. Now, one of the interesting things with this vastus medialis is that when it gets triggered, now, by the way, trigger points are very tight bands of muscle and little areas on these bands of muscle that can refer pain. So you want to find that you can use flat-fingered cross-fiber palpation to feel. So you can see here, now in acupuncture, right on top of this vastus medialis, there's a point there, right there, and it's a really great point for knee pain. In trigger point therapy, this trigger point in here, and what you want to do, try and feel for tight bands of muscle in here and any really tender spots. And most definitely, if you press on it and the person says, "Hey, that's the pain that I get," okay? So you can ask them, does this does this feel like the pain you're getting, or it might be just localized. But either way, what you want to do is work on it. Now I can feel that tight band right here. It's very, very sensitive. So double thumbs, you just work there. You could rotate one way or another. You could gently pulse, or you could just have sustained pressure. Okay, so that one is a really good one, especially if the person's getting referred pain, sort of the medial aspect, the inside. Okay, so that's your first one. So what you do, you palpate. Now, if you're doing this on yourself like I am, you might also go along here and go, "Oh, that's really tender there, really sore." So you can do that as well, because there might be other trigger points along the muscle. Okay, but normally they're right in around here. Okay, now, so that's the first one. So another one, this is when it came to acupuncture. I think they call them the cow's eyes, or just eyes of the knee. So you can see you got your patellar tendon there. It's either side of that, and what you want to do is you want to go. So when I was doing acupuncture, the pins would go up under the kneecap, and it'd be fantastic at helping people. So what you want to do is try and get your fingers sort of hooked in. So if you're treating someone or for yourself, try and get them deep, as if I was underneath that kneecap there, okay? So try to get it up under there and pressing up into those, okay? So whatever's most convenient for you to do, okay? But they are really good, especially if people have pain down around this area as well. All right, so there's your first one, and this vastus medialis. And then there's these ones here as well, okay? If someone has pain, sort of lateral pain, sort of referred pain laterally, you can also go in around this lateralis here, and in around just above the knee. So here's the lateral aspect, the outside of the kneecap. Just come up into here, and you can also feel, so do your flat finger palpation. So, okay, I can feel really tight bands in here. So to go back to here, what I was saying to you was, normally with trigger points, the muscles spasm. They'll be really tight. What happens with this one, which is really kind of unusual, is the muscle gets inhibited. It stops working. So remember, we need this one to really help with this kneecap. So it's vitally important. And when it gets trigger points, it stops working. And then the person will have a feeling of the knee giving out. Okay, because remember I told you about people just feeling they don't trust it. Then you definitely want to work there so we can get this muscle switched back on, working again. Okay, so all right, so there's that one. So definitely there. So we've got vastus lateralis in here. Now also, if this person's got pain centrally, so it's very simple. Like I would absolutely be going into this one. Okay. But if it's more lateral pain, you want to start looking for trigger points. It could be referring pain laterally in here. Okay, and also this rectus femoris right down the center can also. So again, you can do your flat finger palpation, and likewise you can just feel. All right, so feeling tight bands up here. So You could, if it's tight right along, you can work all the way along there. Now again, you can do rotations if you want to, it doesn't really matter. You could do cross fiber. So where I get up to here, yeah, I don't know if you can see that, look. You see that right there? I think so. So down here, it's nice and soft. Well, not spasmy. Now if I come up into here, still okay. And that's where it's really, so this is where I want to work. And the rectus femoris can refer pain in the muscle. It's got trigger points, and that's right up here by the ASIS, right up the hip. So you want to be working up there. You can still see a bit of discoloration here, by the way. That's from the gua sha. So working down through there. So you can do this right the way along. Don't forget these points. These points are absolutely fantastic. And you can also go down to stomach 36, which is called the Sea of Life, or it's a longevity point traditionally in Chinese medicine. So there's that eye point, 4 fingers down, there's the shin bone, and then you go a finger width out, okay? And that one is fantastic for knee pain. It's great for energy levels, poor energy levels. So that is a really good one to there. Again, you can just press in. All right, so there's those. There's this one here, 4 fingers down, stomach 36. I'm going to keep it really easy for you so you don't have to worry about them. Working through here so you can feel further up the muscle as you work through. So this could be part, if you've done your massage, you can start doing this or just do this alone. Okay, as you work through. So doubling up on thumbs, keeping my thumbs in good position as we work through. And again, try and feel there's lots of tightness through here as well. So I would be working right along these to really help balance out the muscular tissues from medial to lateral side. Okay, and remember with these ones, as I said to you, really sort of hook up. So I'm sort of going to a midpoint there, if you can imagine there. Okay, so it's going up 45, if I do it sort of more like that. And don't just hit the kneecap, sort of really come underneath there as much as you can. Make sure it's not uncomfortable for the client. And you can have really fantastic results with your treatment.